after our first reel talking about the CREATE protocol, which is what this is. This is a CREATE plus CXL, which is corneal cross-linking protocol. CREATE stands for Corneal Repair Epithelial and Topography Enhanced. And then, of course, we add the cross-linking for this. And so the CREATE protocol, this treatment here, people asked about, hey, what are the actual results? You're showing us these pretty topographies that look a lot better, but what's happening with the actual visions? How are these people doing? Here's a patient, severe keratoconus, 5 diopters of astigmatism, best correction is 20/70. 6 months later, the topography is much improved, the cone is much smaller, 3/4 of a diopter of astigmatism, 20/25. That is a huge jump in vision. This patient here, 6 diopters of astigmatism, best they can do is 20/50 pre-op. That's their cone. This is their cone afterwards, much reduced. Post-op at 10 months, 1 diopter of hyperopic astigmatism, 20/25 best correction vision. So, they ask, essentially, what is this? I say this is a veritable cure for the majority of patients coming in. And questions about this. How is this a cure? Cure is the alleviation of symptoms of a disease. So if we can make vision where a person is 20/25 now, is able to drive and go to work and do the things in life, and these patients, a lot of them are driving fine at night. They can do all the things they want to do without thinking or worrying about their eyes, and they're not progressing anymore. That is, in the definition, a cure. And these patients have a permanent, this should be permanent. The chances of a progression after an epi-off cross-linking are very low. So these patients should have a permanent cure, a permanent treatment, which for them, when they're living life and enjoying life and doing all the things they want to do without thinking about their keratoconus, that's a cure. And that's really important because this particular disease deserves to have more information told about it. Just because not everybody knows that these kinds of procedures exist doesn't mean they don't.